Kidney stones are small, hard deposits that form inside the kidneys from minerals and salts present in urine. They can cause severe pain and discomfort. These are more common due to low water intake and unhealthy dietary habits. Awareness and early prevention can help reduce complications and hospital visits. There are different types of kidney stones. The most common are calcium stones, followed by uric acid stones, infection-related struvite stones, and a rare genetic type called cystine stones. It is important to understand that not all stones are the same. The type of stone can affect symptoms, treatment, and prevention strategies. Many causes and risk factors increase the chances of developing kidney stones. Drinking less water is one of the biggest reasons, especially in hot climates where the body loses more fluids through sweating. A diet high in salt, spicy foods, processed snacks, excessive tea, and soft drinks may also increase risk. People with family history of stones, obesity, sedentary lifestyle, diabetes, or repeated urinary infections are more likely to develop this problem. Kidney stones are formed when urine becomes highly concentrated. When a person does not drink enough water, minerals like calcium, oxalate, and uric acid start forming tiny crystals. Over time, these crystals stick together inside the kidney and gradually grow into hard stones. Proper hydration helps dilute urine and reduces the chance of crystal formation. The symptoms include mild to severe pain. A person may feel sharp pain in the back or side, burning urination, nausea, vomiting blood and urine, or frequent urge to pass urine. If fever, severe vomiting, or inability to pass urine occurs, it should be treated as an emergency. High risk, including outdoor workers exposed to heat, individuals who drink very little water, patients with recurrent urinary tract infections, patients of hypertension or diabetes. Kidney stones are diagnosed by tests such as X-rays, ultrasound, CT scan, urine examination, and blood tests. Early diagnosis helps decide the correct treatment plan and prevents complications, like kidney infection or blockage. Treatment of kidney stones depends mainly on the size and location of the stone. Very small stones may pass naturally by increasing fluid intake and taking prescribed medicines. For pain relief, medium-sized stones may require closer medical monitoring and procedures, like lithotripsy, where shock waves break the stone into smaller pieces so they can pass more easily. Large stones, or stones causing severe blockage, may need surgical removal. Patients should always follow medical advice and avoid trying unproven home remedies. Diet and lifestyle play a major role in treatment and prevention. Drinking enough water daily is the most effective way to reduce stone formation. Reducing salt intake, limiting soft drinks, maintaining balanced calcium intake, and staying physically active are important steps.